Good evening. The coronavirus is the biggest threat this country has faced for decades, and this country is not alone. All over the world we're seeing the devastating impact of this invisible killer. From this evening, I must give the British people a very simple instruction. You must stay at home.
Good morning, everybody. I'm Liz Howarth, the PMO Director for the Vaccines and PPE programme. And first of all, I'd like to sort of apologise that myself and my colleague can't be with you this morning. I think it is a bit of a sign of the times, and obviously we have to be absolutely careful and to make sure that everybody's safe. And we do apologise for not being with you, and hopefully doing this pre-record, you will get more than a sense of what we've been doing and what we're still doing as part of the vaccines programme. So apologies, and hopefully the videos, the way we present this morning, will give you a real flavour of what life has been like and what life continues to be like on the vaccine programme. I'll pass over to Mark in a minute and he can introduce himself, but just to say it'll be the two of us this morning presenting. So you've seen the video as the opening to this presentation, which I think for me, just seeing it, and even though we know we've been busy, seeing it, and I know there's a lot of content in that video, makes me realise how busy we have been, and the pace of this programme, which is something you will hear about, I think, as we talk through it, is quite incredible. It's also quite an emotional programme, actually. And seeing that video, I think, reminds me, even though we're kind of living, breathing it, when you see all those different milestones together, you think, actually, it is quite amazing what has been done, what continues to be done, and the impact that the programme is having. And certainly for me, I think everybody that works on it, you have this sense of pride. You feel very privileged to be part of something. But that's not to say that there are not things that are quite challenging about being part of this programme. So if we just put up the first slide, and then I will pass over to Mark, and Mark will introduce himself as well. But if you put up the first slide, which really encapsulates the mission of this programme. And it has been about maximising the available doses they offer to people, and to do it as quickly and safely as possible. Easy words to say, but actually this mission statement is something, and I've never worked on a programme like it, where we, again, live this mission statement almost every hour, every day, every week, and we keep coming back to it because we've had some very challenging times to meet this mission statement. But it's something, it's very, very alive. It is part of kind of every meeting that we have, and every team member that works genuinely, I would say, understands this mission statement, is bought into this mission statement, and again, I'll talk about it as we go through how that impacts on what we've been able to do. So that's a bit of scene setting. I'll pass over to Mark now, who can give you a bit of an update of where we're at as a programme with the delivery milestones, some of the stats, and then we'll walk you through what we've done, some of the highlights, and some of the lessons that we've learnt as well being part of this programme. So over to you, Mark.
Thank you, Liz. And just to introduce myself, I joined the programme back in April as part of the South Central and West Commissioning Support team, who took over responsibility for running the PMO from that just in kind of February, March time. And I echo everything that Liz says. What a journey it's been and continues to be. And you can see from this slide, you know, and these are pretty much up-to-date figures. It's quite incredible to think that since the first vaccination took place with Margaret Keenan on the 8th of December, we have jabbed, if we use that term, 87 million times over the course of the period up to date. I mean, that is quite phenomenal, and it is really only being delivered by that buy-in to the vision that Liz described, and the hard work and efforts of a huge number of people, nationally, regionally, at local system level, and on the ground in terms of delivering those jabs. And the outcome of that is clear to see. Huge number of hospital admissions prevented. Over 24 million infections prevented, and ultimately, over 127,000 deaths prevented. And these numbers are ticking up every minute, every hour of every day. And I think to explain how the program management has worked and the approach, we've used this term VUCA to kind of describe the context. You will see from the pace of the program and the milestones that were set out in the video, a huge amount has happened at pace, and it's quite a volatile, uncertain, complex and ambiguous environment to be planning and applying the discipline of program management within. And it's presented some challenges, but we've had to look at how we can be agile and responsive to working in that environment. On the face of it, it's quite simple. The Medicines and Health Regulatory Agency, or the MHRA, they approve a vaccine. Then the Joint Committee for Vaccination and Immunisation provides advice on who should get that vaccine, in what order, what dose they should have, and how much of an interval should there be between doses. They provide that advice to the government. The government make a decision and then ask the NHSE to take that decision and operationalise it and implement it. It sounds pretty straightforward and simple, but there's a lot of complexity within that. We've got different vaccines. During the course of the programme, we've been working with 3 different types, and there are more in the pipeline. There are different clinical requirements with those vaccines. For example, for Pfizer, there's a 15-minute observation time, but for AstraZeneca, there isn't. There are different dose intervals. We've got different ways of getting jabs into arms. It could be inside your local hospital, at your local community pharmacy, at your local GP practice, at large volume vaccination centre, or even by roving pop-up services that deliver vaccines at a hyper-local level and encourage those more difficult to serve communities to come forward. We've got different groups of people becoming eligible at different times and at pace with different behaviours. And one of the real challenges of the programme is to serve that more difficult to serve group, or hard to reach, not a term I particularly like. But we have to work really hard to make sure that getting a jab is easily accessible. There's ongoing trials, emerging scientific thinking. We're aware of new variants that could threaten the efficacy of what we're doing. And then more recently, there have been new developments, such as 3rd primary courses for those who are immunosuppressed. We've more recently gone into planning for and delivering boosters, as you've heard. And of course, now we're in flu season. So alongside this, delivery of flu vaccinations into arms is as important as COVID vaccination. So, probably the word complex is too simple a word to describe the complexity of the programme. Alongside this, we've had changes in Health Secretary. There have been changes to the SRO for the programme. And, I think one of the things that, recently I had some time off. You take a day off in this programme and it feels like a week. You take a week and it feels like a month, because things happen so quickly. It sometimes feels you come back and the world has changed. So back to the beginning, an operational plan was initially developed pretty much 12 months ago. And there was a nationally led command and control structure that was put in place, providing national oversight. But as the programme developed, the focus, and it became clear, the focus needed to be in hyper-local activity on the ground, system-led deployment that would really get to those communities that we needed to get jabs into arms. From a PMO perspective, the kind of getting things up and running was led by Morehouse Consulting, working closely with us, who were involved at that time, parts of the programme. But as things progressed, responsibility for program management, as I said at the outset, transitioned to ourselves. So if we can move on to the next slide, let's start by a quick look at kind of the operating model that we were providing program management support to. So what's on this slide is a fairly sort of simplified model of how the program is work, and it has continued to adapt and change as we learn and reflect the requirements of the program as it changes. But you can see here, this covers quite a broad range of areas that are important to the program, from the supply of vaccine to kind of our strategic thinking and planning, to the capacity we've got to make sure that that's aligned with the demand that we need to service, performance, communications. Equalities are really, really central part of the program. Policy teams, and how we deliver locally. 11 work streams looking at a range of areas, including data, technology, as well as workforce, clinical and service evaluation, to ensure that we're continuing to learn as a program, are all built into this model. We have a central program management office function, around 24, 25 posts, which it's a large team, but we'll come on to later to describe the broader program, and you'll see how that's kind of contextualized. But within that team, we have both central functions that really drive and hold the discipline of those core functions you'd expect a program management office to hold. But we also have members of the PMO team who are embedded in those work streams to provide an interlock, so that we can knit together what's happening at a work stream level with the program overall, and play that back to the program and keep the program on track. We have a number of external stakeholders that we have to work closely with, and there are a number of external reporting requirements that the PMO services, Public Health England, as was now the UK Health and Safety Agency, the Department of Health and Social Care, Cabinet Office, Number 10. Obviously, this is one of the top priorities at the centre of government. And now more recently with the Department for Education, with the vaccination programme in schools. So a number of key stakeholders that we need to keep engaged in the programme, keep briefed and involved in development of the programme. I think it's also important to reflect that the makeup of the team and the PMO team is from all different backgrounds, environments and experience. Early in the programme, there was a heavy military involvement and support to the programme. They're still involved to a lesser extent. There's ourselves as NHS South Central West, NHS England, NHS Digital, and we have a real mix economy of people that work on the programme: substantive staff, fixed term contract staff, staff recruited through agencies, commercial partners, commercial consultants. But what has been central to the programme is what we call the hashtag one team approach. And that has been really important. So regardless of your employer and your background, we work as one team with that mission at foremost in our mind in terms of delivery. So at that point, I'd like to hand over back to Liz, who's going to talk about ways of working.
Thanks, Mark. And this is perhaps not the most traditional diagram or way of talking about a PMO that people may be familiar with or may have seen before. But I think this really reiterates what Mark was saying about how we work as a PMO team and how we work as a programme. And Mark's outlined some of the functions, and I wanted to just explain a bit more kind of what lies behind, because, you know, everybody can see a diagram and the functions can make sense, but as people know, it's kind of how things happen on that daily basis, and how you work together, that can really make the difference, particularly on a programme like this, where the pace and, as Mark has said, the complexity is a real challenge. Some people might be familiar with this diagram. It's kind of based on a neuros level kind of thinking and philosophy. And for me, having worked on a number of programs, this is something that I think is important to think about, even as a PMO. It's this kind of whole pyramid. And we've talked about the sort of purpose, which has been very clear as a program. And sometimes, and I've worked on programs where actually getting that purpose and that shared purpose is really, really difficult. And that is the one thing that's probably most challenging to get right, and to get people focused and staying linked to that purpose. And the ways of working just talks about all these sort of different elements that we've looked at and worked through as a PMO, as a program, to make things work, from environment to the sort of behaviours going on to capabilities. And I'll just give you a few examples just to kind of bring this to life of what this has meant for the vaccines programme. So if we come on to the next slide, just pulls out some of these elements to kind of give you some examples. So I imagine so many people at the moment, and the fact that we're sat here today in different venues virtually, the environment has been a very interesting one to set up a programme in. And I know we're all kind of living this at the moment, and it's brought challenges for all of us. But to do a national programme that needs to be delivered locally when you're setting up a team virtually, and doing a lot of that virtual working with people that have not necessarily worked together before, don't necessarily have that long-term relationship way of working. And as Mark has identified and pulled out, the number of organisations that have and continue to work on this programme is vast. So creating that environment where actually you're doing a lot of virtual, we have had some face-to-face or ability to come into a central point, but it's been very, very limited. So doing that and doing that at pace, what that has meant is that we have a lot of virtual meetings. What that has meant for a PMO is that we service a lot of virtual meetings that have to be very on time, at pace, all the kind of slides ready, the support behind it, the turnaround of any notes, actions, and that kind of virtual environment has been incredibly challenging for sort of a whole number of reasons. But at the same time, and what's been interesting for me is working as a PMO, it's been quite levelling. I think sometimes working virtually, you almost the hierarchy of perhaps kind of life before the pandemic, that environment is challenged more, and actually the PMO has been seen probably more than ever as an absolute key part of that virtual environment and making that virtual environment work, probably more than had we set this up in a different time. Some of the things I'll just sort of call out around behaviours. This has been really interesting, and as Mark again has alluded to, we've had so many different people. We've had military staff work on this, and some of the learning that we've got as a PMO, as a programme, has been incredible from military colleagues about taking risks together, about having these what we call kind of go, no-go points and no regrets decisions. Where is it, what needs to be true? We used to say, what needs to be true today to make a decision about this? What is this a decision that we will make, and it'll be a no regret decision? So that language of going back to that one team, understanding we're taking a risk together, that we need to understand it, we need to size it, but also there is an element of going, right, today is a go, no go point. And that's what we will do, and we will make it happen, and we will go forward from this point, which sometimes, particularly in a public sector environment, can take weeks of going via committees, papers, assurance processes, etc., etc. And some of the learning we've done as a PMO is how do you do that at speed to get the right level of assurance, the right kind of evidence, but actually to make it happen quickly. I think around sort of beliefs, I think people can probably imagine how much, and again, as a PMO team, we've had to kind of hold our nerve around what we're doing and believe that actually this is going forwards, we're making progress, it is the right thing to do, we'll take the next step. Not knowing, as Mark again has identified, that there are so many twists and turns, so many different variations, so many different points that can happen. But we've got to be agile and to make sure that we can kind of hold our nerve in terms of what we're doing as a team, and pull together. Last thing I'll just pull out on this slide, it's around kind of capability. Again, Mark's talked about the PMO has been a team of people, very different backgrounds, different skills, different levels of either project, program management, and that actually has really worked, because I can really say literally every team member has brought something different to the team, a different perhaps skill, way of looking at things, different experiences, and we've managed to blend it and to find a way of making it work. And I was explaining to somebody the other day, I said, you know, this for me has been less about having almost a traditional program director or a PMO director. I felt like I've been a jungle guide of kind of trying to understand the terrain, cut away some of the kind of wood and the kind of obstacles in the way, look for the tracks, look for the signs, try and think about the next move, the next direction we go in. And for me, it's felt more like that, and that's how we've needed to work as a PMO, less about a sort of a transactional approach, but it has been about that. What do we know today? What do we think is going to happen next week? What do we think we need to have in place, particularly from a meeting cadence? And we'll talk about this in governance and what we've had in place to kind of keep making this work, keep moving forwards. And that's what we've had to do as a team. So I'll hand over back to Mark, and we'll take forward and pick the theme up as we go through.
Thank you, Liz. Just reflecting on what Liz has said in terms of that makeup of the team. You know, I have an extensive operational background in the provider context within the NHS, and that stood me in good stead, because, you know, managing operations, you deal with ambiguity and rapid change in the NHS all the time, and so getting that right blend of skills and having you know, the benefit of people from different backgrounds, I think, really added value to what the PMO was able to offer. Now, you can't talk about running a program, particularly of this nature, without talking about how we approach risk. Yeah, it's, you know, it's part of the standard toolkit and responsibility of a program management office, and that's no different for this program. But I think the way we've approached it and had to be very agile and engaging and managing a broad range of stakeholders to get them really engaged in risk management, I think has been a challenge, but one that has been met, you know, successfully. You know, as we said, it's, you know, a very ambiguous. What's true in the morning could be really different by close of the day, you know, with rapid planning assumptions changing daily, or, you know, a range of scenarios that we're planning for, not quite sure what one we're going to land on in terms of what we're going to have to deploy. So from a risk perspective, our risks have been quite fluid. So the way we've approached it is starting from the bottom up. So I mentioned earlier having members of the PMO team embedded in the work streams on a day-to-day basis, working to those work stream leads and supporting them in terms of the governance and the PMO aspects of their work stream. And through those interlocked PMO team members, really working to encourage and embed a really robust approach to identification of risk, identification of mitigations and controls at a work stream level. And then building on that, we had a central risk team as part of the central PMO who would work with them and the workstream leads within the programme to firstly ensure that we have a consistent approach to how we measure risk. And for those of you, I'm sure you'll recognise sometimes the challenges of, you know, a particular work stream really pushing forward a risk at a work stream level that should be top of the list at a programme level. So, which may not take into account the broader context. So it's a risk, and quite rightly, they're passionate about that risk and the need for that to be visible, and there to be an understanding of how we're managing that. But it doesn't necessarily elevate to that programme level. So having an expertise at that central point enables us to have those conversations, moderate, have a standardised approach. We're not perfect, but we've put a lot of effort into that. And then at the same time, taking those workstream risks and integrating them into a set of programme board level risks that we have ownership of from the workstream leaders, but they recognise that it's an integrated risk that stretches across the programme, is not necessarily related to a single workstream. And we have a regular process of stand-up meetings throughout our meeting cadence, where we're constantly having that conversation, testing, updating. You know, and our risks across the programme have changed quite considerably. So in the early days of the programme, you know, supply was quite a key risk for the programme. You know, there was uncertainty of supply, and you know, there was a real need to make sure that we had very tight controls and we had really effective systems to get the vaccine to the sites where the jabs were being put in arms. That's still a key area of the programme, but has become less of a concern because of the systems that have been put in place and greater certainty of supply. More recently, and going back to the opening video, it's been, you know, around the complexity of the programme and managing different cohorts and different dose intervals, and different and new ways of getting jabs into arms, such as the schools programme. So the complexity of the programme is a risk that has emerged as the journey has progressed. So risk is really important and very visible, and is regularly reported to the programme board. Yet there's more we can do to improve it. But I think that balance of having that central expertise at a senior level with that embedded approach within the work streams has really enabled us to mature our approach to risk. Back to you, Liz. I think you're going to cover one of our kind of key building blocks around how we manage problem solving.
I am, and thanks, Mark. So we talked about the kind of cadence of meetings that we've had, which, you know, it's quite easy to sort of dismiss the kind of value and the purpose of getting the right cadence at the beginning of the day, at the end of the day, and during the day. I know it's kind of, it sounds, you know, kind of really simple stuff, but actually for a program like this, and if you go back to what I was saying about, and so much has had to be done virtually, again, it's like that every single meeting has had to be really, really clear and had to move the program on. So one of the key sort of elements that was introduced, and we've been doing it, you know, throughout the journey of the program, and I know these get called different things in different places, is this process of deep dives, which is a place, and we've again done it from almost a daily basis to twice a week to 3 times a week, depending on kind of where we're at as a program, of problem solving, and to do it in quite a structured way, but around a particular area that we recognise as a team we might not have an immediate solution to, or that we need to think through very rapidly the different implications and different scenarios that we may need to look at, and to do it in that spirit of we almost need to find the solution by the end of the meeting. And this has been very much we go back to the whole one team, that, you know, almost anybody can bring a topic, a theme, a particular problem statement to a deep dive. It's about getting clear. We are all understanding what is the problem we're trying to solve, particularly on a program like this, because we can have a lot of things that come in and you think, you know, is this a real problem to be solved? Is this just something that actually, you know, there is a solution there? It's very similar to something we've done before. Is this something that we haven't really kind of dealt with before? You know, how much time and energy do we need to put on this? And it's very much an opportunity to get a group of stakeholders together across the programme, regionally, nationally, locally, because, you know, with a programme like this, I said it at the beginning, where it's a national programme but needs to be delivered locally, you need that breadth very, very rapidly of people to come together to help work on problems and to help find solutions. That there's a danger as a national team that you can think we're looking at it from a certain perspective, but how that translates and what that means, particularly, I think Mark mentioned the kind of real local solutions that we've put in place to find what is the best venue for somebody in, you know, the middle of Birmingham to access a vaccination, as opposed to somebody who's living on, you know, the south coast. It's like, what are the things that we need to factor in? How do we ensure equity of access? How do we ensure that the process, you know, is safe, is rapid, etc. And it's been something that has now become a way of doing business, of having a deep dive, people seeing it as problem solving. It's not seeing that, you know, just because I haven't got the solution, I've got to kind of go away and I can't talk about that as a programme. It's an accepted way of working, and I think it really has helped with the pace and delivery, without a doubt, of the programme, and to do it at speed and having that right membership, and people coming together and understanding that is the purpose of a deep dive. We've cut through so many tricky, thorny issues very, very quickly. So just wanted to highlight that. So I know people probably call it something different in different places. If you go on to the next slide, the other thing that just wanted to touch upon is about planning, and again, Mark has referred to this. I want to use word planning, and without a doubt, as a team, we have tried to think what is coming next. We have a team within the programme that think about different scenarios, what could happen, you know, in 6 months' time, in 12 months' time. But also then we have, and a core part of the PMO has been to help that, how do you take from a potential scenario into how do you make that a plan? How do you make that in a plan in an environment that is so changeable, that there are lots of variables that we're having to deal with, and the timescales that we're dealing with can be really, really challenging. And I think some of those words on the kind of slide there are words that, you know, I'm sure a lot of people will recognise about having to be flexible, having to think of different contingencies, having to kind of expect change as we plan. And one of the things I think the team has got incredibly skilled at is an ability to do work on critical paths. On a page, very visible, everybody gets it really quickly. This is where we're at today. This is the critical path. This is what needs to happen so we can move from X to, you know, to A, from B to whatever. And that is a skill that I would say as a PMO that I'm very proud of how well the team have kind of dealt with that, managed with that. And just as an example to again bring that to life, people are probably aware that fairly recently, since September, we've been offering vaccinations to school-aged children. And this was a potential scenario that we were learning about earlier, sort of in the year, but we started to do some planning for in July. when there was some interim guidance that came out. But this was a situation where we had to be really, really careful in terms of managing sort of expectations. As you can imagine, I mean, one thing we haven't talked about that much is like the media interest on this programme. I think all of us working on it have become really, I think our families think we're really strange because we just don't talk about what we do. You daren't say anything, you daren't hint at anything because, you know, you're so worried that, you know, the next day it will be like, programme is now going to vaccinate X, Y, and Z. So a lot of the planning we've had to do as well, whilst it's a national programme, we've had to involve a lot of stakeholders. We've had to do it in a way that sometimes we've had to minimise the number of people that can be involved, and we can only take some of the plans so far because we've been waiting, as Mark explained, for the guidance to say now, you know, we can open up a certain cohort, we can now vaccinate school-aged children. And with the school-aged children, people probably are aware the headlines of JCVI wanting to consider kind of the wide aspects. So we had all sort of go live dates and we had a plan. And then there was the ask for the CMOs, the medical officers, the chief medical officers of the 4 nations to consider the implications. So that built in some different timelines, some different variables we had to think about. And once there was clarity and a decision made, there was a real expectation that we would start offering vaccinations within 5 to 7 days in an environment where, as a programme, we hadn't vaccinated this cohort, we hadn't vaccinated in a school setting before, even though there were school immunisation services. This was on a different scale, at a different pace, different media around this, so many things to consider, schools just going back, dealing with everything that they were having to deal with you know, getting up and running as a school, and then they ask around offering vaccinations. So in terms of planning, in terms of trying to think through the different scenarios, things from supply, demand, capacity, equalities of what it meant for children if they weren't at school at that time, giving enough time and support around consent. I think this was one that was probably one of the most challenging as a PMO. And they asked to keep updating plans, to keep having a critical path that changed, but also meant that we could meet, when we were asked to sort of open up the programme, we could actually meet the timelines. So all in all, I think that in particular has been a real massive learning opportunity for the PMO, but has upskilled the team unbelievably. And I'm certainly very proud of how people dealt with that sort of complexity at that time. So I think now, am I right thinking we're going to show another video? Oh no, sorry, Mark, you're going to talk about the grab a jab. This is another element, isn't it? But another aspect of the programme.
It is, but something we're really proud of. I think one of the things that you know, would describe the PMO offer into the programme that we've been able to achieve, and that's been through the kind of credibility and the strong relationships that we built within the programme, is that we always see ourselves as offering a PMO plus. So it's all of the things you'd expect a PMO to deliver. But because of the breadth of experience and backgrounds and knowledge, and I mentioned my operational experience earlier, we've been able to jump in when we've identified a problem through a deep dive and we need to mobilise something really quickly, and perhaps add something a bit more than just your typical PMO support. And I think the grab a jab is a really good example of that. So, you know, as we move through the cohorts, we started to need to reach to much younger groups of people. You know, older people, you know, typically those over 65 are much more used to getting vaccinated already. They'd be used to every winter getting a flu jab, and they're very used to visiting their GP and engaging with the NHS on perhaps a more regular basis. Younger people, much more active, not possibly visited their GP. Some of them may not be registered with a GP and have not interacted with the NHS for a long period of time, or maybe not at all. And vaccinations maybe, other than what they remember from being at school, maybe something that's a little bit alien to them. So we needed to, we recognised that we needed to be able to offer a vaccination to these councils in a more accessible way. And we need to do this quickly to meet the mission of getting jabs into arms as quickly and safely as possible. We had a national booking system, which you could go online, you can book, pick your preferred location and search for a date and a time that suits, etc. And that's been brilliant for the service and has enabled millions of people to access and get a jab. But we found that maybe younger people were not as keen to access that, and they just really wanted that kind of drop-in culture, and access opportunistically. What the concept that was developed was the concept of grab a jab, and we developed a website and the development of which was really principally led by the PMO. And it's a real example of how we were adding additional value. Firstly, we needed to understand, where are the vaccination sites where we could offer grab a jab? Where do young people go and frequent on a frequent basis? How are we going to capture the event? All of the kind of elements of the process to make sure that it's safe but also accessible. We led the work, we worked through the detail, we created the website, we managed the need to get a lot of information from local sites and local systems so that we can accurately enable young people to know where they could drop in to access a jab. And going back to the pace and the way of working, from the initial idea on the back of a problem that had been identified to having that website in place where you could know where you could drop in for jab, we managed that in 8 days, which is quite incredible when you think about the complexity involved in landing, what essentially was a new way of communicating and providing access to our population. I'd like to perhaps move on now to, oh no, Liz, sorry, it's back to you on the battle rhythm of the programme.
Thanks, Mike. You can tell it's quite difficult to do this, isn't it, when we're so it's actually easy when we're actually in a venue and we can see the slides. So apologies, people, but I think in terms of the battle rhythm and the governance, I'm conscious of time as well. I think I've probably said and talked about it enough in that, it was really, really key that we had a really clear, what we call battle rhythm of meetings, being clear of the purpose, in the morning, in the evening, checkout points, and did this from a place of, particularly in the morning of, and I know it just sounds a bit cheesy, but it kind of were of, what do you need today to be awesome? And that was actually very much the military colleagues who kind of started with that, really asking people and making sure that everybody had what they needed that day to get through the day, and coming from that place of, as a team, how can we help you? How can we add the value? How can we kind of, move the dial today? And that was very much a focus in the morning, and then checking in the evening of, have we done what we said we would do? What do you need going into tomorrow? And whilst this isn't by no means, but I feel I've got to say it because I heard it so many times, certainly from military colleagues. This is one, and Mark's going to talk about kind of well-being in a minute. But one of the questions at the end of the day, or one of the things that the military colleagues used to say was, and don't forget, sleep is a weapon. Which actually felt so important. The times that we've gone through as a team, where I have to say there's been some 7-day working, almost felt like 24-hour sort of working, and to keep the energy and to make sure that we were clear about what we needed to achieve every day. That has been a big part of making sure that people are looked after. So I'm not going to say too much more because I'm conscious of time, and I think we are going to play a video now. So again, just to give you a sense of what this has been about.
It takes courage to step out in a storm, to work around the clock, to move things forward. It takes an army of people to develop a vaccine, to test it, to trial it, to roll it out to us in our millions. It takes dedication to roll your sleeves up and say, I'm going to play my part. I'm going to drive through the night to reach every patient. I'm going to answer all their questions and reassure all their worries. It takes traffic marshals, soldiers, support workers and nurses. It takes firefighters, first aiders, scientists and doctors. It takes smiling volunteers to come this far. It takes kindness to give up your weekend, your place of worship, the stands that you sing from. But every second of sleep lost and every dinner time missed means one more smile of relief, one more loved one protected, one step closer to normal, a way out of this thing. Every vaccine gives us hope. So play your part, roll your sleeves up and get the vaccine.
Mark, I think you're on mute. I know we've only got a couple of minutes, I think, to kind of wrap up these last sort of couple of slides. So we'll touch on team wellbeing, and then I'll just do a final some of the lessons.
Great, thanks, Liz. Yeah, so I think as Liz alluded to, with this kind of challenging environment and uncertainty, it does mean that we're starting early in the day, we're finished late in the evening. We need to be responsive to the needs of the programme, and everybody is wanting to give the best of themselves. Therefore, the well-being of the team has been really vital and has been a fundamental way of our working. My motto is nobody struggles on the team. Nobody fails on the team. We will work together. And we will respond really quickly if we've not got the kind of capacity and demand balance right. So always regularly checking in with the team on how people are feeling, either individually or collectively as a team. It's been really important. There's a range of measures that we could talk through that we've put in place. But I think the key thing is that regular discussion, the regular touch points, and we've had dedicated sessions to wellbeing, so that we can share ways of which to manage stress and manage your own kind of wellbeing, etc. There are a range of tools that we've got across South Central West and the NHSE, and we've really worked hard to make sure that our team feel able to access those, know where to go, but also more importantly know that they will be listened to if they're feeling the kind of pressure of the programme and need some support. So really important, and I think the one team ethos across the programme has really supported that approach. Everyone recognising that we're all in this together, and we will support each other in delivering what needs to be delivered. Thank you. Back to you, Liz.
Thanks, Mark. Again, we'll just put this up. I am so proud of the team. I've never worked with a team like it. It has been incredible. And I think it's been a good experience actually, for literally everybody who's worked on the team have got something out of it. It's been, I can't say enough, it's just been a brilliant team to be part of, a brilliant programme to be part of. Final few things I'll say on kind of lessons, because we've talked about them actually as we've gone on. So we've gone to the final slide, is one of the lessons that we've learned is that this has felt like, and we've said it actually several times, it's like building the plane whilst you're flying it. And what does that mean as a PMO? Whilst, you know, we've almost had to have things in place, risk sorted, all the governance in place while we're still trying to evolve and, you know, the pace of the programme. And it's that making sure everything is as robust as it can be, but has enough flexibility that if we do need to change kind of mid-flight, we can do that. We've talked about how we've taken risks as a whole programme and had these sort of go, no-go decisions, no regrets decisions, which has been really important language for people to feel safe and supported, that we will make decisions and there are decisions that we have to make, and you will do it with the best understanding, knowledge, data, evidence you have at that moment in time. And the final thing that I will say, one thing I've learned, and again, our SRO, Dr. Emily Lawson, talks about this, is that as a programme, a lesson we've learned that this is a pie competition, or sometimes we call it a cake competition, is that as much pie as we eat and as much as we sort of vaccinate, and it's felt we've vaccinated in different cohorts, different populations, the prize that we keep winning is more pie. In that it is fantastic that other age groups are coming forward. There's a booster programme, as Mark talked about. There is particular focus of a third dose for people who are immunosuppressed, and how you kind of deal with that as a team, as a PMO. And another colleague best described it is like it's doing 2 marathons, a sprint, a kind of 100 meters, followed by a marathon, and then a cross-country competition. It's like, how do you pace yourself going through this, where we have to keep thinking about the long term, the short term, the sprints to get us through to some of these challenges that we're set. And as we say, and we know at the end of it, the prize will be more pie and more opportunities for the programme. So I just want to say thank you so much. Hope this has given you a glimpse of life and the PMO for the vaccine programme. Hope you have a great day. If people do want to know any more, there's certain aspects, or if we haven't covered, this is how to get hold of us. And thank you so much. I'm sorry we couldn't be there. And thank you to Mark as well for your time this morning. Have a great rest of the day, everybody. And thank you very much.